Welcome to CardioPharma Tips. Today we are speaking about medications to be taken 3 times per day. In the last video we mentioned that most of our medications in cardiology are taken once per day, and then we have spoken about the medication to be taken twice per day, like some of the antithrombotics, recontrolling medications, antiarrhythmics, anti-ischemic, anti-failure, and some of the miscellaneous medications. What about the medications to be taken t.i.d, meaning 3 times per day? These medications have short t-half, and so they are not covering the 24-hour or even the 12-hour period. That's why they need to be taken 3 times per day. Let's start with the rate-controlling medication. We have two famous examples of the non-DHP calcium channel blockers, which are considered to be class 4 antiarrhythmics. They have predominantly negative chronotropic, dromotropic, and inotropic effects. Verapamil to be taken 80 mg 3 times per day, and diltiazem 60 mg 3 times per day. They are short-acting forms which are the main preparation, but there are now available long-acting forms like verapamil 240 mg or diltiazem 180 mg, sometimes abbreviated as SR, standing for sustained release, and we can increase the dose up to 480 mg for verapamil and 360 for diltiazem. That's why we prefer these long-acting preparations, but sometimes we may give the short-acting forms in patients who have borderline low blood pressure. And of course, reminding ourselves that they are the gold standard medications in SVT and fascicular VT, beside also the idiopathic PVCs. Another example is the metoprolol tartrate, which is a short-acting cardioselective beta blocker that can be used in hypertension, some of the tachyarrhythmias or angina, but not approved yet in heart failure. And of course, we have the short-acting forms taken 3 times per day, but there's available long-acting forms in doses from 50 up to 200 mg once per day. And we need to remind ourselves that metoprolol tartrate is different from metoprolol succinate, which is a long-acting form taken once per day, and it is approved to have a mortality benefit in heart failure patients. Another famous example is Propranolol, which is a short-acting, non-selective beta blocker. So it can be used in patients with palpitation like inappropriate sinus tachycardia, and have a specific use in patients with thyrotoxicosis due to its non-selectivity. So it blocks the beta-2 mediated effects of thyroxine, like tremors for example, but not approved in heart failure. The short-acting forms here are the main preparation. We can start by 10 mg 3 times per day up to 40 mg 3 times per day. Rarely we may need to increase the dose to a maximum of 80 mg 3 times per day. And of course, it is rare to use propranolol in hypertension due to problems with compliance, as it is difficult to advise a patient with hypertension to take his medication 3 times per day. Let's move now to the antiarrhythmics, and we have a famous example of the propafenone, which is a class 1C antiarrhythmic used in a dose of 150 mg 3 times per day. It can be used in patients with Wolff-Parkinson-White syndrome, for cardioversion of AF, which is a famous example of pill-in-the-pocket approach, and also for maintenance of sinus rhythm, and in patients with idiopathic VT. It is contraindicated to be taken in any patient with structural heart disease like heart failure, coronary artery disease, or LVH, and so it is used only in patients who have structurally normal hearts. Mexiletine is another famous example of class 1B antiarrhythmic that's used in a dose of 200 mg 3 times per day, used in patients with a scar-related VT, in patients with LV dysfunction, as here it is shortening the QT interval, so there is no risk of torsade de pointe, and also in long QT syndrome type 3, which is caused by a gain of function in the sodium channels, so here using a sodium channel blocker can be a cure. And it is not contraindicated in structural heart disease like class 1C antiarrhythmic like propafenone or flecainide. That's why we can use them in patients with heart failure. There are no cumulative side effects as amiodarone, and no QT interval prolongation as many of the antiarrhythmic medication. And one of the famous titles for Mexiletine is the oral lidocaine, because it has the same therapeutic effects of lidocaine, but it is given orally, so I can prescribe it for the patient to be taken at home. Regarding antihypertensive, we have the classical medication alpha-methyl-dopa, which is used in a dose from 250 up to 500 milligrams 3 times per day. It is considered to be one of the antihypertensive to have a central effect, and so it is used in hypertension, especially during pregnancy due to its safety profile, and also in refractory hypertension, but it is not one of the first choice medication to be used in hypertension. Avoid after delivery because it may increase the risk of postpartum psychosis, and as we mentioned, it is not the first line and not widely used in hypertension except in pregnant patients. And we are ending our video with one of the miscellaneous medication, which is sildenafil. Sildenafil here is used as a phosphodiesterase inhibitor to produce a vasodilator effect, which reduces the pulmonary vascular resistance and pulmonary pressure in patients with pulmonary hypertension, group 1. And of course, there is no evidence for its use so far in patients with group 2, indicating left heart disease, group 3 for the lung disease, or group 4 for the chronic thromboembolic pulmonary hypertension. Its strongest evidence is in group 1 pulmonary hypertension. And here it is used 3 times per day, starting by 5 milligrams up to even 20 milligrams 3 times per day. But in patients with erectile dysfunction, it is a PRN use, as here the patient used it before the sexual intercourse. So at the end of our video, we have mentioned today some of the famous examples of medications to be taken 3 times per day in our cardiology practice. Of course, I didn't give a complete list, so let me know in the comments if you know much more examples. We have mentioned the rate controlling medication like verapamil, diltiazem, metoprolol tartrate, and propranolol, antiarrhythmics like propafenone and mexiletine, the classic antihypertensives, the alpha-methyl-dopa, and the use of sildenafil in patients with pulmonary arterial hypertension. The strongest issue for these medication is the compliance, because any patient, when you tell him that you are going to take this medication 3 times per day, he may tell you, please give me a medication to be taken once or just twice per day. 3 times per day may affect the patient compliance. That's why we don't usually use this medication as a first choice. We usually use them in refractory cases or when they are the only option available for us. Thank you very much for watching this video, and wait next week for the next video in CardioPharma Tips series.